Oh, okay.
Good morning, Barb.
Hi, how are you, Blair?
I'm doing well. We got Chris Caius and Brett online. We got Kenyon and Lewis. I am, wow, that was really bad. I'm sorry.
It's okay. It doesn't matter.
Here in the room. There you go.
Hey, Barb, where are you at this morning?
Sitting in my office?
In Aurora or
Yes.
home? Okay.
I'm so disappointed. I came to see Barb.
I know everybody came to see you live.
Oh, I thought you would be home, Kenyon, and our positivity rate is off the
No?
roof, guys.
I'm trying to get back in the swing of things.
Everybody should be at home today. Everybody. I don't want to start my retirement with COVID.
Oh, but you know, like this is your last actual committee meeting.
I know.
So we were kind of hoping to see your.
Well, she
beautiful
won't get
face.
any of the cake or the champagne.
Well, that's what I was thinking. Well,
Yeah.
the champagne, I don't think we were going to give her anyway. Because she's got to go back to work. We don't, but she does.
Yeah, I'm sitting here. I'm sitting in my office. If you could see me, it's yeah, I was coming, but then I just said, oh, we're
No, I so get it.
600%. It's the positivity rate is off the charts right now.
Yeah.
COVID is everywhere.
It is.
Good morning, all. Dr. Silva and Director Jeffers, I think you're leading by example.
Well, thank you.
Good morning, everyone.
Hey,
Good
Brad.
morning.
Not used to the schedule going first. I got nervous about getting in.
I think Chairman Lewis had the right idea, not make you suffer through all the stuff we have to go through.
No, I'm interested in it.
I told Rachel, put Brett first. That was a good idea.
I thought it should just go alphabetical. That sounds nicer.
No, I did, yeah, animal before, yeah. Well, the thing of it is, you know, animal control, you always have good news. And so it's kind of fun to start on a good note and then get to the bad stuff.
Well, see,
I thought that's why you wanted to end on me, because it
that's
went
what I
positive.
thought too.
Oh, well, maybe we should start and end with you.
That's what I think the end with good news is better than the end with bad news. But
Yeah.
I like the beginning and the end. So you can do your reports in the front, Brett, and all the happy stuff in the back.
Yeah.
You always have good news.
Whoever.
Anyway, you have news that makes
Nice
us
mask.
smile. You have news that make us smile.
We have a card from our committee for her. We were going to give her flowers, but Monica was supposed to bring those.
What?
I said we were going to give her flowers today. Monica was supposed to bring them.
I hear you, Anita. You want me to?
I don't mean that in a negative way.
Anita, we could hear you.
That's okay. Oh yeah, because I was over by. So yeah, my mic is off, but I was over by Kenyon and his isn't.
But,
There's no.
What good is a celebration if the celebrant isn't there?
Yeah, for sure.
He was the only reason I was going to expose myself.
Yeah.
You know, I'm telling you.
So it's all right. It's okay. So the card that obviously that we're doing card for you, but I'll just drop it off because I know where you work.
Well, thank you. And I'll be sitting here.
Yeah.
Uh,
So there's
Hello,
no clock in this
Chris.
room anymore, which is kind of cool.
oh, we got a minute. We have 1 minute.
Yeah, I know.
Hi, Anita and Barb. This is Chris checking
Chris.
in. Just want to be here for Barb's finale.
Yeah.
I thought you came to hear me speak, but that's okay. I understand.
that too.
So we're just going to wait another minute or two because we have pretty much everybody here.
Oh, Michael, how do I see you and I don't see myself?
Do we have Alan here?
No, but you did get.
Can
the
you,
comments sent
do you see your
Sanchez.
video down in the lower left?
Oh, I see.
you wanna
All right,
see that.
okay, now I see me.
There you are.
All right,
All right.
hi, Michael.
Hello.
Can you
It's
see me?
nice to see you guys, but
Oh,
I'm not putting my camera on at all.
I see you, Jared.
All right. Good morning, Barb. Good morning, Michael. Jared.
Angela.
I just wanted to say
Oh.
hi.
Morning.
Wait, how can you be with the Chronicle? You're not Brenda.
I'm not. She's on vacation this week.
What? Who allowed that?
She needs some time off. What's your name?
My name's Anita Lewis.
Anita Lewis.
Yeah, yeah.
Very good. You're the chairman of the health committee here?
Yes,
Very good. Well,
yeah.
it's nice to meet you, Anita.
So how long you been with the Chronicle?
I started in 1980.
Oh, okay. All right. So a year or two?
So I've been there, I was there, but I'm just a stringer now.
Oh, okay, all right.
So,
So my sister works for the Chronicle too.
oh, what does she do?
Her name is Vicki Foley.
Oh, my goodness. Yeah,
You know,
you and I
Vicky.
met. We met at the
We did.
congregation-
We
the
did.
Congregational church. when
Yes,
the
we
sheriff was
did.
giving his presentation.
Yes, we did. Yes, we
Well, it's
did.
Nice to see you.
I didn't recognize you behind your mask. Okay, I think.
Hi.
Okay, I think we will go ahead and start the Wednesday, November 18th meeting of the Public Health Committee. If you would do the call to order.
Silva,
Here.
Allen, Kenyon,
Here.
Sanchez,
Here.
Thomas,
Here.
Weber,
Here.
Here. All right. So we need approval of the minutes from October 21st, 2020. Kenyon and Weber. Can we just do a roll on this? Call the roll, please.
Allen, Kenyon,
Yeah, yes.
Sanchez, Silva,
Yes, sorry. Sanchez, yes.
Silva, yes.
Thomas,
Yes.
Weber,
Yes.
Yes. Okay, thank you. Budget finance, nobody is here to present the reports, but they are on file. Any questions on the reports that I need to pass on? Okay, seeing none, hearing none on the phone, we'll move on. No public comments on agenda items. So we'll move right on to the animal control report.
Good morning, everyone. I was just waiting for the reports to pop up. I do have a presentation to present to you this month, but first to cover their budget. We had a good month. We were estimating about $120,000 loss on the year due to COVID, the animal hospital shutting down, and where we're at. Some of the checks from the veterinarians have started coming in. You'll see we made a little profit this month. I've also been able to reduce our expenses this year by about $6,000 per month, which has really helped us stay in our budget. Because again, we want to ensure that we are independent and we don't have to put a burden on the county at any time for finances. So we really did our best. And all this was done ensuring that no expenses were shorted for the animals. What we cut out was maintenance. We have a 14, 15-year-old building now that needed some maintenance here and there that we've kind of pushed off till next year. Next month, I'll be presenting the what was in our budget for next year, the floors. So we'll start moving forward with that, but we really wanted to ensure that we made it through this year within our budget and making sure that everything was comfortable. And as you can see this month, there was a profit of revenue over expenses, which is fantastic. Two things I did want to point out is this has been the year of 2020. Our water heater did go out. We had to buy a brand new water heater. Our HVAC system, one of our smaller ones, went out. We had to purchase a new HVAC system, and we were still able to ensure that all of this maintenance was done to keep the building running, the animals comfortable and happy at all times, and still stay within budget, which has been huge for us to make sure, again, that we're not a burden on the county. I do have a presentation on our vaccine clinics, if you guys have that available.
Working on it.
Sure, thank you.
I guess I don't. Is it in the packet?
No, the one I sent you through email.
Sorry. Coming up.
No problem. Thank you, Blair.
Hey, Brett, while he
our vet-
finds that, you want to go ahead
Yeah.
and do the resolution while he finds that?
Sure.
There you go.
Oh, never mind, he found it. He's so good. Oh, how cute. I love that dog.
Yes.
So I wanted to present our statistics this year. This has been a really rough year, but we have learned a lot, and I think animal control has grown from COVID exponentially. And I think our animal control response, our animal control preparedness is more prepared today than we were when I started 6 years ago. And our vaccine clinics kind of taught us that we can do it through anything. So next slide, please. The year 2020, our April and May clinics were canceled due to COVID. So we ran into some problems. We had to modify how our clinics were run. Normally, everybody went through our building. We're very proud to show off our facility, and we love that the public was able to walk through our entire building through the vaccine clinics and show off kind of, we're proud of our building. We're proud of what we do, and the community really enjoyed seeing us. But we had to stop that this year. We went to more of a mobile, and some of the problems we ran through was how do we social distance? How do we provide enough PPE? How do we move traffic, staffing, and equipment? Well, we were able to figure it out, and we went through a drive-through clinic style. Our Saturday clinics, some people had to wait in line close to 3 hours. Animal control provided water. We provided dog bowls to those that needed it. We provided poop bags, excuse my language, to those that needed it, to ensure that those people that waited were taken care of, and appreciated their patience working with us, especially at this new style. We brought in a second veterinarian, as we usually do for our Saturday clinics, and we were able to move people through very safely. And I'm proud to say that after every clinic, no one got sick, no contact tracers called us to let us know people sick came through here, and really people didn't have to get out of their car. We were able to handle it in such a way that it showed us that if we need to mass vaccinate animals again in the future, we have the equipment, we have the ability, and we have the plan in place to get it done. Next slide, please. As you can see, this is our number of yearly clinics we do. Per Illinois state law, we have to do a minimum of 2 microchip clinics per year. Either has to be centrally located or at our facility. Actually, animal control facility meets both of those. We're pretty well centralized in the county, and it is our facility, so it works out beautifully. We also, on top of that, we're responsible for ensuring animals are registered and vaccinated for rabies. So we've added those onto our clinic. So not only do we do the microchips, we can do a rabies shot. We try to work very well with our veterinary partners. We don't want to take away services from them because they are very important to our community. They provide services, spay, neuter, heartworm checks, feline FIV tests, and additional shots that we can't provide. We're just here to make sure that those people that can't afford it, especially the senior group is our biggest push, and I'm going to show you that in a minute, really have the ability to get the services done that are mandated by law and are able to do it and can afford it. Again, King County is very lucky. We're one of the only counties, and the only county I can say, that provides free tags to seniors that are age 65 and older. That's a really important thing we can do, especially for that category of people that need the help the most. Next slide, please.
Sorry, trying.
No problem.
There you go.
This is a nice graph to show the number of animals vaccinated. You can see that we had a wonderful push this year. Next slide, Blair. It has breakdown a little better. As you can see, 2020, sorry, I got to move my screen now. There we go. 2020, we saw 343 dogs and 76 cats. Cats are really important. Cats have been a big push for us because cats are difficult when they go to the vet. And remember, we did this outside in a tent, and we were able to see 76 cats safely. Not one cat got away from us. We put in some amazing protocols to show that not only can we handle the dogs, we can handle cats in an outdoor environment to keep them safe and protected. Next slide, please. This is a breakdown of the dog comparison. It's better on the next slide. It's just fun to see these little graphs. As you can see, this is our big numbers. What I'd like to point out is the 2020 statistics. 176 neutered or less than 1 year, 59 non-neutered, and the key category is that 104 seniors. Our biggest push is this senior group, like I said on the tags. We work really well with Elgin Police, the Kane County Sheriff's Department, other members of the Hoarding Task Force to get this out to the senior community. We want to ensure that they understand that there is the ability to ensure that their animals are protected at a reasonable cost and remind them about those free tags. So this is that number that I love seeing going up every single year. And the fact that I can see 104 seniors came to our facility this year is really important to me. Next slide. Oh, real quick, thank you to Susan Stack at the Health Department for her amazing articles she put out in the press releases. I want to make sure she gets noted for that because those press releases are fantastic and they really help the community know that we're here. This is the yearly breakdown of cats. Next slide. Here again, if we look at the 2020 statistics, again, those cat numbers this year were fantastic. 34 seniors, again, for that cat. It continues to grow. Being able to do that safely, again, through this drive-through style was, I don't know if it's been done before. Probably has, just not in this county. The fact that we learned from it and we're able to do this prepares this county in the future if we need to do a mass vaccination to animals and knowing that we have a plan in place to do it safely. Next slide. The breakdown of our yearly microchips, you'll see it's starting to level off. Next slide, please. That's the 52 from 2019, 52, 2020. And the reason for this is we microchip year round at this facility. If someone calls us and schedules for a microchip, we will get them appointed, an appointment, we'll bring them in. We'll do those year round. We don't hold up on those. And again, with microchips, they're not like vaccines. Once you get a microchip, you're set for life. So we want to ensure we're microchipping as many animals in this county as possible. And not only that, those microchips then get entered into our system to ensure that their permanent records are set. So should that animal get lost, we have their information, not only with the microchip company, but with us here at this facility. And again, those microchips are $15. That is actually set by state law, not by anybody here. Next slide, please. Our yearly clinic revenue. This is a nice little graph that shows there was a nice jump. Next slide. Even with the two clinics being missed this year, we were still able to see hundreds of people for vaccines. That's huge. And like I said, some people waited 3 hours, but we learned a lot. We learned how to do it safely. And again, we're not about revenue. The government's not here to do that. A lot of this money goes into overtime. Every one of my employees that works for these clinics is working on overtime. Not only are they putting in their regular shifts, they're coming Saturdays, they're coming after hours Wednesdays. We're paying another veterinarian to come in. So we put it back into the clinic. Like I said, we provide water, reusable dog bowls that we give to people to show how much we care about this community, and we want to ensure that they're protected, they're safe, and they remember us and to get vaccinated. Next slide, please. If you have any questions, please let me know.
Hey, Brett, this is Anita.
Yes.
Do you think that once we get through COVID, and we will eventually, that we will continue with these drive-through? Because I know with taking my dog to my vet, I love the fact that I just sit in my car and they come out and get my dog.
I actually loved the drive-through clinic this year, and that's actually something we've been discussing. Because we were able to purchase the tents, purchase the lights, and the equipment to do it, we may stay this route. We really did enjoy showing off our facility to the public, and that is one of the aspects we miss. But to be able to see that people were able to get through without having to get out of the cars was fantastic. We did have about 2 or 3 cars overheat in line, which we weren't happy to see, but we understand we can't control those sorts of things. We did have 1 car accident of 2 people that got too close, but we adjusted our signs. We got people to pace the cars a little better, so we learned a lot, and I hope we do continue it, and that's something we're actually discussing right now, not only with the veterinarians that did it, but also with the staff. And I do appreciate your input of knowing that you appreciated it, because it's good to hear that feedback from the other side.
Yeah, okay, thank you.
Of
Other
course.
questions?
No question. Mike Ken, and a compliment. I've been here a long time, and you are the best, Brett. It took so
thank you.
long to find a man of your capability to run that clinic with your excitement. So thank you for being here.
Thank you for saying that, but I must say it takes a team, and Barb has been one of the strongest rocks I've ever had the privilege to work with, and it's going to be very sad to lose her, but I appreciate all the wisdom and the knowledge she's given me to assist in carrying this facility forward into the future, and I thank her for that.
Thank you, Brett.
Okay, any other questions for animal control before we get on to his resolution?
No questions, Madam Chair Lewis, but this is Barb. I have a statement. Regarding your budget next year, Brett, I hate to inform you, you're going to be reduced by $10 because I'll be eligible for those free tags and I intend. So you can reduce your budget by $10.
Thank you for the heads up. It is appreciated. We'll start adjusting now.
All right, I think there's no other questions. So Brett, if you want to go ahead, we'll do the resolution.
I'm ready when you are.
Okay, so this is a resolution to rehiring of an office assistant. It is in the budget. The amount is $22,750. I need a first and a second, which is Miss Allen, who has now joined us. Good morning. And Mr. Kenyon. Any questions? Okay. Let's call the roll.
Allen,
Aye.
Kenyon,
Yes.
Sanchez,
Yes.
Silva,
Yes.
Thomas,
Yes.
Weber,
Yes.
Okay, resolution passes. Anything else from animal control?
No, I just want to take a moment to say thank you. It has been an absolute privilege to serve this county, and I couldn't be prouder to be here, and I couldn't be prouder to provide this service to everyone. And your support from everyone on this board, the support from Barb and everybody, I do appreciate it, and thank you.
You're welcome, and I think we all agree with exactly what Mr. Kenyon said this morning. I always look forward every month to hearing your report because there's always something new and innovative going on with animal control. So thank you very much.
Of course, and we have some fun things coming next year that I think you're going to appreciate too.
Awesome. Okay, moving along, we have director's report. And I just want to say up front that because this is Barb's last meeting, I think we're going to have a lot of things that we want to say about Barb and maybe even cry. But let's hold that to after her report. And but I will allow time at the end for all of our comments to her. So moving along, Director.
Okay, well, thank you. And then I'll hold my comments to the end too as well. As you know, we always have give you our flash reports to give you a highlight of what's happening or what's occurring. And what's important, I know we're consumed with COVID, but I can't stress enough, you know, I've always says, you know, the most effective way we can prevent flu is with a vaccine. And unfortunately, we're seeing a lot of complications with the flu and COVID today. I've mentioned this in the meetings before. You could have the flu plus COVID, and that's really not a good combination, but it's occurring. So your protection, we have a vaccine for one, the flu, and the other we don't. So it's important to get your flu shot. And we recognize we have vulnerable populations within our community, our homelessness population. And so what we've done is we've got our medical reserve corps together, and they helped us, and we went out and did flu shots for our homeless shelters. So we did Hassett House on the 5th, the 12th. We did Lazarus yesterday, and we're scheduling the Eldon Pet. So it's really important we keep those guys too free of flu as well as COVID. Next slide, Claire. One of the things that is going on right now, again, until our vaccine is on the scene, we have mitigation, and now we have testing for COVID. And currently the health department has antigen testing. This is that rapid test. It works best when you have symptoms. It has a higher valid rate of, the validity is higher with symptoms. The manufacturers developed it for symptomatic individuals versus those who are not symptomatic. And so the health department has received shipment of those, and what we're doing is working in conjunction with our community to distribute those antigen tests or rapid tests, as many of you know. But the name that we have is MyNext Now. That's the type of test that we currently have. And so we're working with our schools, our first responders, our sheriffs, in our hospitals to get this test out to the community so that they can provide this to individuals. Now, the test that we provide is no cost to our consumers. and our residents. However, this test is also offered in a lot of urgent cares and places like that. And I must alert you, those are not state sponsored tests, so you will have to pay for them. So I would encourage you, if you want a rapid test, to go where they are state sponsored and there is no cost. Next slide, Blair. Okay, thank you. You know, in the midst of all of this, normal things happen and things that are ongoing. And one of the things is November is Pancreatic Cancer Awareness Month. And I still want to make sure that we understand that other chronic illnesses and acute illnesses do not go away because we're in a pandemic, and we really have to be vigilant about that. One of the things that we are noticing is that our community is really, for fear of COVID, are not paying attention to their other health needs. And it's really important, if you start having symptoms of other things, that you alert your physician right away, because pancreatic cancer has one of the highest mortality rates of all cancers. It's the third leading cause of cancer-related deaths in our country. And so it's really important, if you're experiencing symptoms of any kind, that you don't delay it because your fear of COVID, of going to seeing your physician. We have a lot of telemedicine going on. And so to prevent some much more complicated issues occurring down the road, I really encourage everyone to be vigilant and to seek out your physician, whether it's telemedicine or going into the office. Next slide, my presentation on COVID, Blair. So, as you know, each month I give you a presentation on what's going on for COVID and some highlights. Next slide, please. So when I submitted this presentation last week this was the data for November 11th. And at the time, we had over 260,000 tests in Kane County. We had over 2,300 confirmed cases and 366 deaths. Since last week, and our positivity rate was 13.2, and our cases per 100,000 was 380. As of today, our positivity rate is 16.7. We're teetering on 17%, and we should be under 8, which is doubled. We are surging really rapidly, as everyone else in the state. And it's important that we recognize that and do all we can to mitigate that. Our case per 100,000 last week was at 380. Today, it's at 563. That is staggering, and we're continuing up. And I expect after Thanksgiving, it will probably be greater. Next slide, please. This is the slide that I showed you last month, and we're a month behind, so I can get the data. So if you recall, last month, this is our slide of cases per age group. And if I'll remind you, in September, the data showed our 20-year-olds were 40%, and that's the yellow bar for those of you looking at the screen, 20% greater than any other age group in the spectrum. Well, now look what happened in October. This is how we know the positivity rate is surging. Our 20-year-olds are at 1,000 cases. Last month, they were at 800, almost 900, and all the others were at 500. Look at our 40 and 50-year-olds. They're at 900 cases. That is a significant increase from just 1 month. They went from 500 cases to over 900. They're teetering on the 20-year-olds. And the only group that's staying relatively low are our 70-year-olds. And if you recall, they were our highest group of spread simply because of what was going on in our long-term care. So when we look at what's going on from the kids through the 60-year-olds, that shows you that is community spread. That is not long-term care facilities. This is indication that the community is continually spreading the virus at a real rapid pace. And so this is why Michael's going to talk to you a bit later about the mitigation that's occurring, but this is what we really have to be conscious of and protect ourselves. And it has not spared anyone in Kane County. And I mean, employers are struggling, businesses are struggling, and we're seeing the results of it right here. Next slide. This is a slide I'd like to share with you. As I shared with you before, each month we will share with you the top 10 municipalities with the most cases. And so this month we have is similar to last month. So Aurora having the highest level, Elgin, Carpentersville, St. Charles, Geneva, Batavia, South Elgin, Gilbert's, Pingree Grove, and North Aurora. And so as you can see, it's interesting that the Tri-Cities are right in the middle and have not been spared as well. So each month we watch this, and what this does for us is gives us an indication, where's the concentration of cases? And it tells you right here, here are the concentration, and then we look at what's going on in those communities, why they have such high concentration of cases. Next slide, please. Well, on November 11th, we went into tier 2 mitigation, and I'm not going to even address this slide because Friday we're going into tier 3 and Michael's going to address it. So it's a moot point now. So next slide. So our next steps around COVID is to continue our efforts. I said it was potential for tier 3. Well, unfortunately, Friday will be in tier 3. We have the antigen test that we are trying to get out as quick as we can to our community. And we have the mobile app, which is the next slide. So I've worked very hard on this, and this was one of the things that if we had the CARES Act money, we would have had this out quicker. And this is why it's important going forward when we have funding abilities, we get it out quick because it takes a lot of time. I'm really excited. I won't physically be here, but I'm a community member still. I'm a resident, and so I will be able to take advantage of this. The health department has, we're in beta testing right now, but we're going to provide our community an app so that we can manage our COVID, every household who has a smartphone. Next slide. This app came from the publichealthapp.com that does custom apps for health departments. Next slide. Here's what the app is going to be able to do. No, this is why we chose an app. From 90% of the people, 90% of the time, a mobile phone is spent with apps. And as you know, you all have an app for this, an app for that. 81% of Americans own a smartphone. 150 times a day, people are checking their smartphones, and 94% of adults between the ages of 18 and 49 own a smartphone. And I say, I'm not in that age group, but I own a smartphone. Next slide. So here's what we're going to have, and I'm so excited about this. One of the things we're going to be able to do is you can contact us right here on the phone and leave us a message versus calling in. You'll leave us a message and we'll be able to get it instantly. We'll be able to push out our social media, you know, our Facebook and our tweets. It's a resource map, and what's good about the resource map, you'll be able to find out where all the test sites are, especially as we push out the vaccines. You'll know where the vaccines will be. And then what we're going to do is log on some videos so that you can find out information around COVID on your own time. A lot of people don't want to go on the IDPH's website. Many folks are saying, you know, it's too complicated, even our own website. So this will give you a video reference so that you can get some live feed from either the CDC or IDPH or other reliable sources like Johns Hopkins and those various reliable sources that we support. Next slide. You'll be able to have a COVID-19 page. It gives you information on our dashboard, our testing sites, what you should know, FAQs, and newsletters, and you can download the CDC app. So that is going to be huge for many folks. You don't have to go home and sit at your computer. It'll be right here. It'll give you a wellness check. We're going to work with the state's attorney to make sure that when folks understand this is not us telling you what it is, but giving you a indication of looking at your daily symptoms and then whether you should call your doctor or not. We recognize mental health has had a huge impact on COVID, and we cannot ignore that. We cannot ignore that. And lots of folks are not being able to reach their providers. So we want to make sure we address that as we go forth. So we're going to have a feature on our app that people can reach out for mental health. And the nice thing about mental health is the COVID has caused us to engage in this is the telemedicine. And what I like about that, I think we'll be able to reach more folks through telemedicine than folks going in and getting individual appointments, because you don't have to live in your community to reach out to telemedicine. So that's going to be a huge plus for our community. And then again, as I said, we're going to have a feature where there's testing in clinics. Next slide, Claire. And as I said, the testing sites will give you the news alerts, just like Michael's going to share the tier 3, and that would be in the press release. And some other helpful links to our other things that we do, and plus the other things in the county like animal control or other county departments that wish to link up to our app. And last but not least, the opioid overdose, because unfortunately we're seeing a rise in that as well. That does not go away simply because COVID is is front and center in all of our lives, but we do still struggle. Michael continues to hold a meeting. I was at the last meeting this week, and we had an overwhelmingly 35 folks on the phone and sharing what's happening in their respective organizations around the opioid crisis. Next slide, please. And so last but not least, we're going to have a push notification. And what that means is, you know how you'll get a notification that you got a phone call or text message, and why it's important to give you the latest and up-to-date information that's happening in Kane County for COVID. So again, it's in a beta testing phase right now. We have to work with the state's attorney to make sure we don't have any liability to our community, because we're not giving health information. And once that's all completed, we anticipate this going live on December 10th. And I'm just so excited for this, because I think, again, we're going to use technology because we don't have the resources to go out and do the marketing, all of this. And this has taken a while. This took about 6 weeks for us to, from start to finish, to get the company and get all the features we wanted and going back and forth. So I'm very excited about that. Are there any questions on those items? Next slide, Brian.
Madam Chairman?
Go ahead, Chris.
Okay, thank you. Say, Barb, this is really exciting, the app, because I've had some inquiries from municipalities here in the northern end of the county about putting the data back on our dashboard on the county website. So this is going to replace that. Is that correct?
Well, we'll still have our website. One of the data on our dashboard, unfortunately, we're about to get it back up. The state is like between 2 and 4 day lag, and when we put it up and our data doesn't match theirs, we get a lot of complaints from the community. So we were trying to hold off, but I have no idea what their delay is, but it's getting to be where it's being difficult for our community. So it won't replace it, Chris. What it's going to do is give you another platform to view the data.
Okay, great. And second question, if I can.
Go ahead.
The antigen, the antigen tests, how do those, I understand what they do. They measure whether you actually have had the, or at least I think I understand, they measure whether you've actually had the coronavirus, been infected. How do they fit in with the control measures?
Hold on a second. No, so you're confusing the antigen test with the antibody test. The antibody test determines if you've had COVID or not. That's not what I'm referencing. The antigen test is another test to determine if you are testing positive or negative. It's the same, it's a different platform than the PCR. And the difference is one is rapid. The antigen test is between 15 minutes and an hour to get the results, whereas the PCR is a lot more valid and it takes anywhere from 24 to 48 hours to get the results.
Okay, great. Great. Thanks for clearing that up.
Sure.
Okay. Any more questions?
Sanchez here.
Go ahead.
Barb, is there any way that we could help beta test this, or do you guys have all the help you need on that?
For the
app?
I'll find out. You know, that's the company that beta tests. So, okay, that would be awesome. I'll find out, Commissioner Sanchez, and I'll get back to you. Okay.
Yeah, that'd be cool.
No other questions? Okay.
Hearing none, I'd like to introduce Michael Isaacson. He's our Assistant Director of Community Health. You all know Michael. Michael, you know, he works hand in hand with me on a regular basis, daily, 7 days a week. I hate to say it, but you know, that's how we're rolling today. And so I've asked him to come and share with you the efforts that we're doing to reduce the spread of COVID, since he is very instrumental in assisting with this major effort. And he will give you the current updated. As a matter of fact, when we got the governor's information yesterday, thanks to Blair and IT, I can't thank them enough. They were able to switch the data really quickly for us because again, this changes so rapidly. Here he was ready to go yesterday and then it changed. So thanks Blair for switching the data out quite quickly for us because it's a major change in what's happening going forward this week. Michael?
Great, thank you, and good morning, everyone. Are you able to hear me okay?
Yes.
Okay, very good. So the information I'm going to share today isn't that pleasant, but I am really happy that I was able to participate today with Barb's last meeting. So we've had the opportunity to work together for a long time, and I've really enjoyed it, and I've learned a tremendous amount. So if we could go to the next slide, Blair. And thank you again to Blair for switching out the slides with the new updated information. The current status, as Barb just showed with the statistics, is really not good. We've seen tremendous increase in cases, tremendous increase in the number of tests that are being done that are coming back positive, and really dramatic hospitalizations. We spoke with one hospital this week. A month ago, they had 10 people in the hospital on an average day, and now they have over 80. So the number of people who are coming into our hospitals is just climbing way too fast. On November 11th, as Barb mentioned, we entered Tier 2 mitigation, but now this coming Friday, we will be entering Tier 3 mitigation. Next slide, please. So some of the highlights or key points for Tier 3, it's really focused on how can we limit gatherings and try to encourage people to stay home as much as possible. So these really are, there's no other way to put it, these are extreme measures we're trying to take to bend the curve again and to reduce the amount of illness that's occurring in our community. So some industries are going to remain open, but they're going to have significantly reduced capacity. And then there's a lot of guidance. Different people, depending on what sector you're in, whether you're a museum or a school or an athletic club, the Department of Commerce and Economic Opportunity has different guidance for all of these different areas. So just a note, where Phase 4 guidance differs from this new Tier 3 mitigation, we're going to use the more strict Tier 3 mitigation rules. And again, some people, it is a little bit confusing. We're in Phase 4, which is moving forward, but then the mitigation rules are additional restrictions that are added to us during Phase 4. Barb has done an excellent job maintaining regular contact with all of our school districts. Many of you probably saw the press release that came out yesterday that Barb suggested that we do an adaptive pause and really move to remote learning for as many of our schools as we can. Those decisions are all made in consultation with our districts. It's really a team approach here in Kane County. And then just a note that childcare facilities still can operate even with the Tier 3 mitigation. This is going to be really important as people are shifting around with jobs, because childcare can be a major burden for a lot of our families. Next slide, please.
Michael, before you go on, I want to
Yes, please.
remind the public, because I know others are listening, because we got this question yesterday. The reason childcares continue to operate, they're an essential service. And so that's why they follow the DCFS guidelines versus the IDPHs. And so they make those decisions with that State Department. And there was some confusion yesterday. I got lots of calls wondering if the child care facilities were going to close. And the other thing I want to make important notice, and Michael hinted at it, we don't close our schools just because the positivity rates go up. That factors into it, but as Michael said, we meet every Monday with our superintendents and we evaluate what's happening and what should occur. And it's from those dialogues and discussions, and we come to a consensus. So I don't just arbitrarily close schools. If you look around us, many other counties around us have been closed at remote learning for a long time. And we recognize our schools weren't being impacted, so we continue to stay open. But as we looked at it's not just the children who might be getting COVID, but the staff. We have to look at the workforce as well. So there are a lot of factors that go into closing schools, and it's just not the positivity rate of the kids, but it's also, if you don't have teachers and personnel to hold in-person school, it makes it very difficult to keep those schools open. So with our positivity rate going up and so next week they're closed and the week after. And what we're going to do is the second week reevaluate with their superintendents what our next steps are. So I just want to make that very clear. This was not done impulsively or just for one factor. There are many factors that go into doing in-person, remote learning for our schools. Thank you, Michael.
Great, thank you, Barb. In the next few slides, I will go through relatively quickly. Just so we could put it into the record, I wanted to include what the Tier 3 mitigations are. So for bars and restaurants, they still should not be having indoor service. They should be closing at 11 p.m. and not opening until 6. Party sizes are reduced to 6 people. This is for outside, which of course the weather's getting chilly now, so it's becoming less of an issue. Although we are seeing some creative, what they call igloos and things that are making it available for people. Next slide, please, Blair. This is a change. So health and fitness, they are being asked to operate at no more than 25% capacity. And anyone who is going to these facilities should not be participating in indoor group classes. And anyone who's exercising there should be wearing a face covering at all times. So that's important to stop the spread of illness. You can see there's some additional things around hotels. Next slide, Blair. For meetings and social events and gatherings, this is where we really have a lot of concern, and it's less of a role for government to police this, and really it's up to each of us to make our own choices. So limiting home gatherings to just household members. This is hard for people. We certainly appreciate that. It's hard for my family. It's hard for my friends. But right now, it's especially important. And as we come up on Thanksgiving, and I know this is a difficult time to be talking about this kind of thing, but we're very concerned about people from different households coming together because we do see a lot of disease transmission that way. Going on, then their meeting rooms, banquet centers should all be closed right now and not hosting gatherings. Funerals are limited to 10 family members. Which also, this has been a very trying year for anyone who's lost a loved one with these restrictions, but it's just really important because unfortunately we have seen disease spread at funerals. which is making an unfortunate situation worse. In terms of offices, we continue to encourage anybody who can work remotely that they should work remotely, but we're working very closely with our business community for people who need to be on site to make sure that they have good safety plans. Next slide, please, Blair. This is another change with the Tier 3 mitigation. We're going to take a temporary pause on all indoor sports and recreation. Unfortunately, this is an area where we have seen disease spread here in Kane County with some of the youth, especially youth sports leagues. So at least temporarily, while we're in Tier 3, we want all of that to stop. Outdoor sports can continue, but we don't want any of the indoor leagues going on or competitions going on. You can see there's some additional guidance about outside activities with 10 or less, and then really emphasizing that face covering should be worn at all times for people participating in these activities. And then down in personal care services, a lot of these are similar to what was in Tier 2, but really trying to limit the amount of exposure that we're seeing there. So if anybody has any questions, we can talk through that as well. Next slide, please. And then retail, limiting capacity so that we don't have big crowds of people. And I think Tier 3, one thing that it does that I think is going to help us in Tier 2, people felt it was unevenly putting the burden on specific sectors, namely restaurants and bars. With Tier 3, we're really looking at a lot more people being impacted, which isn't necessarily a positive, but it does mean that if people adhere to these guidelines, that we are going to see a drop in positivity. We are going to see a drop in cases if people follow the guidance that's here. So encouraging curbside pickup, encouraging people to go to the store and walk in only when it's absolutely necessary. Next slide. There's two graphics that the state released yesterday, I think, that are a little quicker. So this one is what's open during Tier 3. So you can see bars and restaurants for outdoor, 25% health and fitness. So this is just a little bit easier than all the verbiage for people to check. And then next slide, Blair. And then these are things that we're asking to be temporarily paused. So events, gaming and casinos are not operating, indoor sports, as I mentioned, offices working remotely, indoor fitness classes, cultural institutions should be paused. And then the bottom one there is really limiting gatherings inside your house. Next slide. So what are we doing about these community concerns? As these guidelines come out, it's complex how we're able to do enforcement. And this does create consternation in the community. We have businesses that feel we're being too heavy-handed. We have residents who feel that we're not doing enough. So what the health department is trying to do is really focus our efforts on areas where we see the largest risk of disease spread. So we're focused on our outbreaks. We currently have over 100 active outbreaks where we're working with work sites to try to reduce the number of people who are continuing to be exposed. But anytime we get a complaint that comes into our office, and I put the COVID concerns email there on the left, we are following up and investigating every single complaint. If it's something that we believe merits additional investigation, we work with the Kane County Sheriff's Office, who's been very helpful in this process, as well as local police departments to document what's happening. And then we have additional conversations with those business owners to try to get them on board with being compliant. Every case we review on an individual basis. So as I mentioned, we're going to look at what's the risk from the science that we have and the public health data that we're able to collect. Are we seeing illness in this facility, or do we think there's a high likelihood of illness? And then we will intervene at the appropriate level then. But again, it's not straightforward in terms of what level of enforcement authority we have, and we don't want to overreach with our community, but we also want to make sure that people are following the rules. So it really has been a challenge for our office over the past month or so. Next slide, please. So I think the main message I have for people right now is just choice. Regardless of what rules come down from any level of government, every single one of us makes choices every single day. We can be choosing whether we're taking action that could potentially spread the illness or that could help to minimize spread in our community. So just a couple things I'd ask people to consider. Who are you going to be around in a given day? So this isn't limited to just Thanksgiving. This is any day. The fewer people that you're around, the less likely you are to either catch COVID or to pass it on to someone else. And then secondly, what precautions are you taking? Masks do work. They offer some protection to the person who's wearing them. And then they definitely offer protection to the people. They offer protection to you from wearing them, but then they protect other people from you if you're potentially sick. So that's really important. And then distancing. And this is really hard with the holidays coming up. But we really, really emphasize that even if it's people that you're very comfortable with, we don't know who may have COVID. People could be asymptomatic and still spreading the disease. So we just ask that when people are making choices over the next couple of weeks, I think most people in the community have the information. So we just want to really implore them to make the safest choices that they can. And then over on the right is just a graphic that our office has put out for holiday safety tips, which really reiterates a lot of the things that I've already mentioned. And I think that's it. Thank you. Are there any questions that anyone has?
Any questions for Michael?
Good morning. This is Ms. Thomas. I have a question.
Go ahead, Angie.
Yes.
Thanks for the presentation. This is very helpful. I'm just wondering if the poster that we're looking at is available on the website yet?
It is, and actually we're just editing it because you can see the little graphic in the upper left there, wear a mask when traveling. Since we created this poster, we're really encouraging people not to travel. So
Okay.
There will be a new version of this that will be going on our website today.
Okay. I will look for it. Thank you.
Great, and I'll email it to you as well.
Okay, great.
Okay. Any other questions? All right. Thank you, Michael. That was very informative. Okay. Moving along, we do have a resolution. So the resolution is to authorize the purchase of naloxone for funding from the Illinois Department of Human Services. It's not budgeted, but it is a grant-funded thing. And so I need a motion and a second. That would be Ms. Allen and Mr. Kenyon. And do we have any questions, comments? Mr. Weber?
Yes, thank you. I'm just curious as to how long will this last for as far as the $287,000? Is that 3 months? Is that 6 months?
No, this, are you able to hear me?
Yes.
Okay, very good. So this is an increase in funding from the state to allow us to enhance our current naloxone program. So the funding is specifically through June 30th, but with the additional doses that we're able to buy now, we're going to be able to get it to more organizations. So it's not a simple answer of how long it'll last us. It will get us through June easily, but not only at our current levels, but we're actually going to be able to enhance quite a bit the number of organizations we're able to work with and provide naloxone to.
Steve, this is Barb. Also, this might help your answer. So each dose of naloxone or Narcan has a 2-year lifespan. And so when we distribute it to whatever organizations we're distributing, as Michael said, we're expanding our reach. So we always replace our first responders doses, and it's on a 2-year cycle. So whenever you receive that, if you don't use your dose, you get it replaced every 2 years. If you use your dose, you get an additional dose for every dose. So it's 1-to-1. So every dose you use, we replace. And so every dose you have within your possession has a 2-year lifespan. Does that answer?
Okay. I mean, I guess more of my question was how many doses, I guess, do we go through a year or a quarter, or is there like a running average?
We can get you that data unless Michael has it. He's closer to it than I am. Because
and it's, yeah, I think like Barb mentioned, we do replace it on a 1-to-1, but this allows us to make sure that, for example, every police officer is able to carry it. They may not use it. Ideally, they can go the whole period and not use it. So part of this is making sure that it's accessible, just like an AED. You hope you don't use it, but we want to get it in as many places as we can so that people have access to it if they need it. But I can't provide you an update on.
That's okay. That's fine. I understand. Thank you.
No, we do have the data because it works like this. It's not 1-to-1 in terms of the recipient of dose. We've had one recipient, the one I saw, the last one I saw had the greatest amount. We had one person receive 5 doses and he survived, which I was shocked. So we can get you the number of doses expelled annually. We do have that data, but I just caution you, it's not 1-to-1. So every dose is not one person. A lot of folks can use 1 dose, but on average, sometimes it takes 2 doses, and 5 is an extreme.
Okay, thank you.
Okay, that answer your questions? Okay. Any other questions? Okay, then we'll call for a vote.
Allen?
Aye.
Kenyon?
Aye.
Sanchez?
Yes.
Silva?
Yes.
Thomas?
Yes.
Weber?
Yes.
Lewis?
Yes. All right, passes. Anything else from the executive director before we go on to talking about your upcoming retirement? Okay, hearing none, let's move along. First of all, I wanted to ask a question. So what is our plan on December 1st when you won't be with us anymore, Barb?
Well, physically, I will be here December 1st. December 1st is my physical last day. So
okay.
I have a day filled with meetings, so I will physically be here. That is my last official day.
Okay.
I'm currently working with our county chair-elect, Corinne Perot, on looking at the transition since she will be the chairman on December 1st. And I'm working with her to make that decision. And once she's made the decision, I will send an announcement out to all the county board who would be the interim executive director until she determines who will be permanently. And that has to go before the board. Additionally, just so you all know, it's just not the decision of the board, but it also has to be approved by the Illinois Department of Public Health. There are criteria that you must meet to become a health officer. This is this position's official title is health administrator or health officer for a local health department. So it also has to meet that criteria as well.
Okay. All right. Thank you very much. Very hard shoes to fill. I think this is kind of unprecedented, having a Zoom meeting to say goodbye to somebody. But I think if Chairman Lawson is still on the phone, I'll let him start with things we want to say to Barb.
Well, thank you. Thank you very much, Anita. I appreciate that. I did get a chance to recognize Barb the other day at the board meeting. And as I said then, it's true always. She is just a delight. So, and I admire the work that she, she does with pulling together good morale on her team under the hardest circumstances. So, I even got to give her a hug.
Whoa, was that allowed?
Yeah, that's right. I don't know. It will be in the long run.
As long as you suit it up correctly, I guess it's okay.
Yeah, right. Take care. Okay.
All right, thank you. I'll open it to comments from people at the meeting, board members, and we're all kind of sitting here just kind of going, what do you say to somebody that is so important to our functioning day to day?
Yeah, Madam Chair, this is Ms. Thomas. If I could say something, since I too will be leaving. I just want to say I so appreciate the opportunity to serve on the Public Health Committee. I had the chance to serve all 4 years of my term on this committee. So I think it's important to have knowledge of the history of programs and policy decisions, and to carry that forward. And so hopefully that continuity will continue with Dr. Silva and you and others who have also been on the committee a while. But I just want to say thank you to Director Jeffers and her staff, Michael and Teresa, who was initially there when I came on board, and Uche, all of this, her direct reports. It was a privilege just to be in the midst of so much knowledge between them all. And I certainly feel like I'm leaving much more informed as a citizen, and just, have a greater appreciation for the work that they do for our county and our state. I've said this so many times, King County is so fortunate to have the staff that we have with Brett, Animal Control. The health department has been the crown and the jewel, and I know that they will continue to be. So thank you to everyone. I have enjoyed working with my fellow board members, and I will miss everyone. So all the best to those of you carrying on.
Thank you.
Thank you, Angie. From my point of view, I've only been on the board 2 years, but you have certainly been a valuable member to this committee and, to the entire board. And thank you. Okay, Ms. Allen.
I just wanted to toss into the mix that mostly we expect our public health staff to just carry us along and to make sure that the inspections that are part of their purview are taken care of, that when we go into a restaurant, we are safe, or a grocery store. We really don't think much about the everyday stuff swirling around our lives. And then we have these panic moments. We have the animal hoarding case with all those animals that needed to be placed somewhere. We had the salmonella outbreak at that really snazzy restaurant in Geneva. That business where the cheese had to be tracked down. The opioid problem in all communities, all levels of society, and of course a pandemic. And so I think it just speaks very well for the systems and the continuity, and mostly the calm head, the blazing intelligence, and the sureness of mission that, Barb, you brought to us, that the Public Health Department is able to function so well under all these circumstances. And I'm not sure we're going to get that lucky again, but we sure have been grateful to have that clear leadership, rooted in experience, but also quick-footed, also able to say, okay, this is new, this is different, but we can solve it. And you brought that to Kane County as well. So thank you for both the steady intellect and then the quick-wittedness that saves us in times of duress. Plus, it's really nice to have you around. I don't know of a lot of people who would handle pressure so well and day-to-day stuff so well and just be such a continuing joy in our lives. So thank you.
Thanks, Deb.
Thank you. Okay, if there's no other comments, if Barb, if you have anything to say, and then we will move on and close the meeting.
Okay. So for the past 8.5 years, the Public Health Committee has been my favorite committee, no matter who was sitting in those seats. Public health, I always feel like, it's working when things are quiet, and it works when things are not. And I have had the privilege of having the support of the Public Health Committee for the last 8.5 years. For 6 of those years, I've had the privilege to work with Dr. Monica Silver, leading the Public Health Committee. And she's very knowledgeable because she has a medical background as well. So she was very helpful in that regard, and she was very steady, and I can't thank her enough. And then the past 2 years, Madam Chair, Anita Lewis, you have just also been such a component, a supporter of public health when board members were not sure of what direction we were going. You were always able to provide them that additional information in support of the health department. So for that, the leadership has been stellar in terms of who has led the chair of this committee. And I only hope that whoever follows me, that they're fortunate enough to have you guys leading the way as well, to have committed board members. And I know the chairperson gets to select the board members, but it's those who sit at the table, who help us, guide us and support us as we try to navigate all the ups and downs that occur in our public. And I will say each one of you have not let me down. I mean, when I come to you, you have always been supportive and always are able to give me some support where sometimes I didn't even realize the support lied. So I can't thank you enough. It has made my job a lot, not easy, but it gave me the ability to navigate some of those very difficult territories that we had to do. We were, as Deb said, it's always something in public health. And I feel like it's like climate change is coming a lot more rapid than it used to. I feel like, oh my God, I sat here and I had worked here like 7 years, and we really had H1N1, that's about it. And then I step into this chair, and we're in the largest TB outbreak in the country. And then we had Ebola and Zika, and now the pandemic. It's like, oh my God, what's next? And one of you said it, this staff, we're small, but these guys are mighty. They do not let up. And I can't say, I would be remiss if I didn't say that it is the staff. One person cannot do this alone. So it's from your support in the staff that continuously come in every day, whether it's virtual or physically, that really support this community and are committed to addressing whatever the next tsunami that's going to hit Kane County, because it will. If we all go on living, we will have the next infectious disease or a crisis in terms of that threatens our public health. But if you know me, you know I am very passionate about public health. And when you're passionate about something, because the job leaves doesn't mean the passion goes away. So I still will continue to be involved at some level in public health, and maybe not here, because I'm also a firm believer I have to step out of the way. Since I'm choosing to retire, I will not interfere with the leadership of the next leader that comes here, but be more supportive and then being disruptive. And because I think that person needs to be able to lead this team in their own leadership style. So having said that, I will miss all of you, and it's been fun.
Thank you.
Barb, could you leave your cell phone number for us?
No, she's not going to leave her cell phone number. And she's not going to travel because she can't, but hopefully she'll sit home and read a couple good books.
We love you and thank you.
Thank you.
Yes.
Thank you. All right.
Clapping for Barb, Director Jeffers.
All right, let's finish this meeting up quickly before we're all in tears. No old business. I need a motion to replace the reports on file. That would be Mr. Kenyon and Miss Allen. Can we just do a voice vote, or do I have to do that?
Roll call.
Mm-hmm.
Roll call.
Okay, roll call, please.
Allen,
Aye.
Kenyon,
Aye.
Sanchez,
Yes.
Silva,
Hi.
Thomas,
Yes.
Weber,
Yes.
Lewis.
Yes. Okay, thank you. No need for executive session, no new business, no public comments. I need a motion to adjourn.
Move to
Oh
adjourn.
my gosh, nobody wants to adjourn.
Sanchez second.
Okay. It's Thomas and Sanchez. This can be a voice. All in favor?
Aye.
Okay. Meeting adjourned. Thank you.